Before using Ycanth 0.7% topical solution with Applicator, make sure to read the Patient Information Leaflet provided by your pharmacist. This medication is only for use on the skin and should be applied to the affected area by a healthcare professional as directed by your doctor, usually every 3 weeks as needed. It should not be applied inside the nose, mouth, or vagina, or in or near the eyes. The treated area should not be covered with bandages, and after application, avoid touching, biting, or licking the area. Ensure the treated skin does not come in contact with the mouth, nose, eyes, or genital areas. If contact does occur, rinse with plenty of water and seek medical help immediately. It's important to note that this medication is flammable, so avoid fire, open flame, or smoking near the treated areas of the skin. The medication should be washed off with soap and water as directed by your doctor, usually 24 hours after treatment. It may be washed off earlier if severe pain or blistering occurs on the treated area. Avoid applying other products to the treated areas of the skin until at least 24 hours after the treatment or until the treated area is washed off. If your condition does not improve or worsens, be sure to inform your doctor. If you experience blistering, pain, itching, swelling, or a change in skin color after applying Ycanth 0.7% topical solution with Applicator, it's important to inform your doctor or pharmacist right away. It's also important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. While many people do not experience serious side effects, it's crucial to seek medical attention if you notice severe pain, blistering, or swelling at the treated area. Additionally, if you notice symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing, it's important to seek medical help immediately. If you notice any other effects that are not listed here, it's best to contact your doctor or pharmacist for further guidance. Remember to follow the specific instructions and dosage recommended by your healthcare provider for the best results. Before using Ycanth 0.7% topical solution with Applicator, it's important to talk to your doctor or pharmacist if you have any allergies, as this product may contain ingredients that can cause allergic reactions. Be sure to also discuss your medical history and any other medications or herbal products you may be using. If you are pregnant, only use this medication if it is clearly needed and after discussing the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before using it while breastfeeding. If you do use it while breastfeeding, be sure to avoid applying the medication to areas of the skin where the baby may come into contact with it, especially the breast and nipple area. When using Ycanth 0.7% topical solution with Applicator, it's important to be aware of potential drug interactions. These interactions can affect how your medications work and may increase your risk for serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This can help ensure the safe and effective use of Ycanth 0.7% topical solution with Applicator. Remember to consult with your healthcare provider for personalized advice on the best time to take this medication and the appropriate dosage for your specific needs. If this medication is swallowed, it can be harmful or even fatal. If someone has taken too much and is experiencing severe symptoms like passing out or difficulty breathing, immediately call 911. Otherwise, contact a poison control center right away. In the U.S., you can call 1-800-222-1222 for your local poison control center. Canadian residents can call a provincial poison control center. Symptoms of overdose or swallowing may include severe stomach or abdominal pain, seizures, weakness, unusual bleeding or bruising, and changes in the amount of urine. Make sure to schedule and attend all appointments with your healthcare provider and any necessary laboratory tests while using Ycanth 0.7% topical solution with Applicator. This will help ensure that the medication is working effectively and that your condition is being properly monitored. It is important to follow the recommended dosage and application schedule as directed by your healthcare provider. This may involve applying the solution at specific times of the day or following certain guidelines for application. Be sure to discuss any concerns or questions you may have with your healthcare provider. Ycanth 0.7% topical solution with applicator is used to treat certain skin conditions such as atopic dermatitis and eczema. It helps to reduce itching, redness, and swelling of the skin. This medication is for use on the skin only. Apply a thin layer of the medication to the affected area of the skin, usually 2 times a day or as directed by your doctor. The best time to apply this medication is after bathing or showering. Use this medication regularly to get the most benefit from it. Do not use it more often or for a longer time than prescribed. This medication should be applied by a healthcare professional in a clinic or doctor's office and should not be stored at home. It is important to follow the instructions of your healthcare provider regarding the use of this medication. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.